I would like to start with my thanks to HRI for this opportunity to come back and share the results of our study protocol that we mentioned in the last conference with you. Okay, so we have been asked why to study homeopathy for depression, and I think that this is a good study to justify it. This STAR-D study has shown that only 35% of patients treated conventionally have achieved remission, even after 4 levels of randomized treatment strategies. This study has costed $35 million and included 4,000 patients, and only 35% of them achieved remission. Okay, so with this challenge to treat depressed patients, our primary objective was to evaluate the effectiveness and the safety of a homeopathic protocol in treating major depression. This protocol was Hahnemann's protocol. We didn't invent it. It was Hahnemann's protocol from the 6th edition of the Orden, and the study protocol has been published. I should have a laser here. Okay. Here? Okay. This study is a collaboration from our university here, University of São Carlos, in São Paulo, Brazil, and the Federal University of Ceará. The patients and the psychiatrists are here. Marcela, my wife, and myself, we work in this university in São Paulo. We have no contact with the patients. We receive the information through a questionnaire, so there is no this point of empathy or the consultation effect that sometimes we are accused to be. Okay, so as you can see, there are a lot of people here, and this collaboration included not only the psychiatrists from the Federal University of Ceará, but 4 independent laboratories that allowed us to go further and include translational objectives like plasma, proteomics, and physicochemical analysis. And we don't have, or didn't have, $35 million. No, and then we choose to follow this N of 1 design that is a multiple crossover. I think that you are familiar with this design. And we are doing 10 cases. We have finished some patients, but we are presenting to you the first patient that finished, the first patient to finish this study. And the design of N of 1 is considered not only an alternative for large randomized clinical trials, but also the highest strength of evidence for individual subject decisions. This is our study design. So we have an open phase treatment, and this is finished when the patient has a therapeutic response. If this response is sustained for 4 weeks, he is included. And then he follows 3 blocks of treatment, A, B, A, B, A, B, could be B, A, B. This is completely randomized. So homeopathy or placebo, placebo, homeopathy, and vice versa, so on. Okay? So once the treatment proves to be interesting through this therapeutic response, he is included and follow this treatment, randomized treatment, double-blind, randomized treatment over 28 weeks. You can see that the blocks have different durations because we want to learn. We are also doing this to learn how is the response in 2 weeks, in 4 weeks, in 8 weeks. Okay, so our first patient, or first participant or first patient started her depressive symptoms in 2020 and started taking venlafaxine. She entered the study in 2023, and she was taking venlafaxine at 225 milligrams per day with partial improvement because she was still experiencing anhedonia, difficulty with concentrating, reduced energy, and initial insomnia. Okay, so we discussed this in the last conference. These are the symptoms that we use to choose sulfur that combined with patient's symptoms. They are based on the symptoms that we understood as characteristic for that patient. And she had, of course, other symptoms, but these were those that we understood as characteristics, and then we gave her sulfur. As primary outcome, we use this well-known Beck Depression Inventory. Secondary outcomes were the SF-12, mental and physical quality of life, the clinical global impression scale, and for severity and improvement. Okay. Data analysis was very important because we learned this also. So this tau-U statistical test is very interesting for a N-of-1 kind of study. The results. As you can see, the patient started with 32 in this Beck Inventory depression scale. This is severe depression. After 2 weeks taking venlafaxine was there. We did not change her antidepressant. And after 2 weeks, she went to 15, more 2 weeks, 16, and then 6. Then she was included. At week 0, she had a worsening, a small worsening, and this, but she soon recovers again, and you see that in the last period here, in the last block, she improves again very markedly. When we analyze these results, we can see that she has been taking them sulfur, placebo, sulfur, placebo, 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 sulfur, sulfur, okay? Then she started the treatment with sulfur. She was 30, no, okay, here she was in 11, week 0, so sulfur. And then after this is week 2, she went to 7, 8, 9, and then 11 again, placebo, 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 and back to 3. 3 is remission. Scores under 10 are considered remission. Okay, so the results show that during the placebo time, the depression score improved because went high, and the sulfur scores, the depression scores during the sulfur time improved, they were less prominent. The difference was statistically significant, and during the placebo group, these scores increased significantly, and you can see that her improvement during sulfur time compared to placebo controlling for baseline was 78%. This is a very huge improvement. And to the secondary outcomes, you see that the mental quality of life improved during sulfur, but not during placebo. And there was no difference considering the physical quality of life, although she also improved when she took homeopathy, but this was not significant, not statistically significant. But what also made us very happy was, or were, the translational results. Because, as you can see in this complicated slide here, this is a volcano plot showing the proteomics or the protein analysis of the 50 different proteins that appeared during the sulfur, during the study. And as you will see, there were upregulated proteins in patients' plasma and downregulated proteins. And the upregulated are displayed in red, the downregulated are displayed in blue. Most significant comparisons are in gray. So you have those proteins that were increased, upregulated, those proteins that were upregulated and those that were downregulated, okay? So, these profiles, the analysis of the protein profiles showed that you have this cat, sunny cat, that indicates the protein that have been upregulated, and this dog that is indicates the proteins that have been downregulated. You can see that during the weeks of treatment, here she's taking placebo, and here sulfur. And there are two different protein profiles, one here and one here. But there is this strange sulfur here and this strange placebo here. And here you can see that these proteins are upregulated and these proteins are downregulated during the sulfur time, during placebo time, but there are these strange here groups. As you can see here, that those proteins are downregulated and these are upregulated. So, and these different strange results here, if we put this together with the our treatment diagram, you can see that during this 8-week here, excuse me, you can see that these strange results appear at week 8 and at week 4. You have a strange sulfur reaction at 8th week that is similar to the placebo group reaction and vice versa at week 4. And if we go see which weeks were those, we can see that at week 4, at week 8 and at week 4, there were the first crossover time. So this is probably a carryover effect, okay? But we understand that for the type of proteins that were stimulated, that probably sulfur stimulated the immune response pathways. Okay, so the dynamic and DNS and electrophoretic light scattering showed us that the particles were smaller than the hydroalcoholic solution. The sulfur particles were also narrower in distribution size. That indicates that the standardization of the pharmaceutical preparation was very well done, and that those particles has a less negative zeta potential than the hydroalcoholic solution, indicating that these particles tend to aggregate. Okay, so there they are, our particles, seen in electronic microscope, and they have these are sulfur particles, and they have a size, in this nanogram, they have a size of 50 nanograms, medium size of 50 nanometers, sorry, nanometers. So what's also very interesting is that we found sulfur, the mineral, in the solutions, in the homeopathic solutions. So you can see that the mineral sulfur was found in the LM2, 3, 4, 7, almost in the same quantity. No? Okay? This did not happen in the blank and not in the hydroalcoholic solution. There's no sulfur from the bottles. And also lactose control. This lactose control we prepared exactly as a homeopathic medicine without sulfur. Only without sulfur. And we could see that, you see that there's no measure of the mineral. And this is astonishing because we have the same quantity. And this combines with this theory of aggregation of the nanoparticles. Okay? Okay, I don't have time for more. And so during this study follow-up, the patient was able to discontinue the vanilla vaccine. 6 months after, she wasn't taking anymore this antidepressant. And this is for us a truth. From a physicochemical perspective, Heinemann was a pioneer who empirically developed and utilized nanomedicines in his clinical practice. I would like to thank everyone for this opportunity.